So I've been having some trouble with my horse lately, and I was wondering if you could help me out. He hasn't been eating. He's been super apathetic. He doesn't really walk in a straight line anymore. He always staggers around, and he's swinging his head like he's got some kind of neurological problem. And he's just been weird lately. He's also had a high fever, and he even had a seizure. And you know, we've got lots of mosquitoes around here, and I don't use fly spray or fly masks or anything like that because I feel like that's a waste of time. I mean, they've been bitten up by mosquitoes so bad. See, he doesn't even know what that is. He's crazy. But yeah, we have a stagnant pool of water over there. There's a bunch of mosquitoes, and he's been bitten up really bad. And he's almost 2, so I'm hoping I can have him around for a long time. Do you think there's something wrong with him?
Hi, nice to meet you. I'm Dr. Spencer. Okay, so I reviewed your video, and it seems to me that your horse is exhibiting symptoms of Eastern equine encephalitis. There's only one way to be sure that your horse actually has this disease. We're going to have to take a blood test. The results won't come back to 2 to 5 days.
Okay.
Okay, so your horse's test came back positive, so he does have Eastern equine encephalitis. So basically this disease is caused by a mosquito bite that has previously fed on an infected bird.
My other horse isn't exhibiting symptoms, so how do I keep him from getting this disease?
Well, you said you didn't use fly masks and fly spray, so I think since it is caused by mosquito bite, I think it's really important that you use bug spray, fly masks, and keep all of the water in your troughs clean and their water buckets. Make sure those are changed frequently, which keeps the mosquitoes away, and try to keep all the standing water out of your paddocks and pastures, which prevents mosquitoes also from ganging up in one area.
Are there any other ways I can prevent it?
Make sure you vaccinate your horses. You should really do this about twice a year, starting from between 3 to 6 months of age.
Okay. So what does this mean for my horse?
So the Eastern equine encephalitis, it spreads to the brain. It causes inflammation, and this affects the nervous system of your horse. That's why your horse is exhibiting signs of blindness and uncoordination, and also the seizures.
So what are the treatment options for my horse?
So there is only a 20% chance that your horse will make it, but the treatment that we can give you is corticosteroids, anticonvulsants, and supportive measures. So basically the corticosteroids and the anticonvulsants are just to treat the symptoms of your horse. And some of the supportive measures are intravenous fluids, tracheal intubation, and antipyretics. So although you can't get this directly from your horse, because horses are a dead-end host, you can get this from the mosquitoes on your farm, and since there's so many on your farm, I would recommend you go see Dr. O'Connell to understand the symptoms you could possibly experience.
Okay.
So tell me why you're here today.
Well, I was recommended by a vet to come talk to a doctor because I have a lot of EEEV positive mosquitoes on my farm, and my horse contracted Eastern equine encephalitis.
Okay, so if you're bitten by a mosquito that's infected by EEEV, some of the lesser symptoms you may feel are headaches, fever, and chills. Have you had any of the following?
I have had headaches.
Okay, that may or may not be due to the fact that you've been bitten by a mosquito, but some of the more severe symptoms include disorientation, seizures, and coma. So it's very important that you see a doctor if you start to get any more of those lesser symptoms, because the disease can cause permanent brain damage. Unlike the effects on horses, the mortality rate for humans is only 33%, but still one of the most severe mosquito-borne illnesses people can contract. So the only thing we can do is supportive care, so you must seek medical attention right away.
Thank you very much.
Eastern equine encephalitis is characterized by its effects on the central nervous system. Inoculation starts with an infected mosquito, oftentimes the Culiceta melanura mosquito, injecting the virus into the cutaneous and subcutaneous tissues of the skin. Eastern equine encephalitis virus is maintained in a cycle between Culiceta melanura mosquitoes and avian hosts. The spread of this disease occurs through the bite of a mosquito that must feed both on mammals and birds. Culiceta melanura mosquito is not considered to be an important vector of this virus to humans because it feeds almost exclusively on birds. However, horses are susceptible to EEEV infection and in most cases are fatal. The infections in horses are not a significant risk factor for human infection because horses, like humans, are considered to be dead-end hosts for the virus. The reason why they are dead-end hosts are because the concentration of virus in their bloodstream is usually insufficient to infect most mosquitoes that would pass it along. Although the virus cannot be transmitted through blood transfusion or via the aerosol route, it can cross the placenta and infect a fetus. Once the virus has entered the body, the symptoms of headache, fever, chills, and weakness can be attributed to the virus replicating in non-neural tissues near the mosquito bite or in the lymphatic system. Cell-to-cell spread of the virus happens across the axons and dendrites of the neurons. This is when the secondary symptoms, such as disorientation, seizures, and blindness, occur as the brain tissues are being destroyed and neurological problems begin to arise. An autopsy of patients affected by EEEV reveal swelling, leptomeningeal vascular congestion, hemorrhage, and softening or loss of brain tissue. Corticosteroids and anticonvulsants will help treat the symptoms for Eastern equine encephalitis virus, but because there is no current treatment for this viral disease, make sure to look after both you and your horse by applying bug spray in mosquito-prone areas, as well as using a fly mask and bug spray for your horse when out in the paddocks.